Hello, I'm Nykki Hetherton, Dementia Clinical Nurse Specialist in Lewisham and Chair of the End of Life Working Party at South London and Maudsley NHS Trust. We appreciate that for many of you this is an area you are unfamiliar with and may cause you to have concerns about end of life care or care of the deceased. We want to highlight some resources that are available for you to reassure you that the Trust wants to support staff in dealing with these situations. If you work in another trust, please refer to your local policies.
Hello, I'm Claire Squire. I'm a community matron with PMOA and an end-of-life care working party member. For the past 3 years, we've been working on the end-of-life care policy and issues related to this, mainly for the people in our directorate, focusing on those with dementia. Due to the COVID-19 virus, we're now having to think about a wider group of people, those who might get infected in our units, and sadly some who may die. We have made a short video for you to watch about the care of the deceased.
Please follow the most up-to-date recommendations for the use of personal protective equipment.
It's really important never to leave the deceased patient uncovered and to use a white sheet to cover the whole body if you have to leave the area. This is really important to maintain the patient's privacy and dignity. For COVID-related deaths, please follow the infection control guidance.
Your patient will need to also wear a mask for this procedure.
Position the patient on their back as soon as possible and position the limbs in a natural manner, arms by the side, and removing all but one pillow. Close the mouth and support the jaw by placing a pillow or rolled up towel underneath the chin. Do not bind the patient's jaw with bandages. This is to avoid leaving marks on the patient's face, as this can be difficult to remove later on. Gently close the patient's eyes if they're still open by applying gentle pressure for 30 seconds. Drain the full bladder by pressing on the lower abdomen and collecting urine in a receiver or catheter bag. Leakages may occur from other cavities in the body.
So he's got an ulcer on his legs, so just have to be careful. Yeah. There we go. Lift your legs up. Press down. There we go. Got a pad.
Place an incontinence pad in situ.
Pad in there.
Any wounds should be covered with a clean, absorbent, waterproof dressing. The stoma should be covered with a clean stoma bag. Wash the patient unless requested not to do so for religious or cultural reasons or carer's preference.
For COVID-related deaths, it's not appropriate to perform mouth care. Mementos or keepsakes, such as a lock of hair or a handprint, may be offered. These must be placed in a sealed bag and not be opened for 7 days.
Just bring his arm, shall I? Yeah, right, lift his knee up. And I'm just gonna pull you towards me.
When moving patient, air can be released, and this can sometimes be confused with breathing.
Not to be alarmed if there's any leakage from any orifices, which sometimes happens. Pad around a bit, so here we go. All right. Okay, on your back again. There we go.
Dress the patient in personal clothing or a white garment traditionally known as a shroud, depending on the policy or the family's wishes. Remove all the jewellery in the presence of another nurse, unless requested by the family to do otherwise. Jewellery remaining on the patient should be documented in the notification of death form. Record the jewellery and other valuables in the patient property book and store the items according to local policy. Avoid the use of the names of the precious metals or gems when describing jewellery to prevent potential later confusion. Instead, use terms such as yellow metal or red stone. Rings left on the patient's body should be secured with tape. Ensure that the correct hospital patient identification label is attached to the patient's wrist and attach a further label to the patient's ankle. Wrap the patient's body in a sheet, ensuring that the face and feet are covered and that all limbs are held securely in position.
Deceased property should be handled with care. Any clothing or blankets should be ideally disposed of. If they must be returned to families, they should be double bagged and not open for 7 days. Anything that can be wiped down should be wiped clean with hospital disinfectant.
Right. Okay. I'm just going to roll again.
Roll the patient and place a clean sheet underneath. Ensure the bottom mattress sheet is also clean or consider changing this at the same time.
There we go. I'm going to roll you, John.
Often nurses continue to talk to the patient as a mark of respect during this procedure.
Working from the feet upwards, tightly wrap the body in the bottom sheet, ensuring that the limbs are aligned and secured and all parts of the body are covered. Tape the sheet at the points where they meet together, ensuring security of the wrapping. The sheet points over the head should be accessible. Complete any documentation such as notification of death cards. These can be found in the hospital policies. Please attach a notice of death to the outside of the body.
In the event of a COVID-related death, the specific COVID-19 notice of death should be completed. For more information specifically around spiritual and religious leads at the end of life, please refer to the Trust policy.
Here are some of the resources that we have developed for you at SLAM. There will be an end-of-life care tile on Maud, which will include the end-of-life care policy, care of the deceased video and other helpful resources. There is an email address where you can ask for advice. This is eolc.advice@slam.nhs.uk. The duty senior nurses, DSN offices, are on each site and they can be contacted via the switchboard. Care of the deceased boxes will be in each DSN office at the Bethlem, Maudsley, Ladywell and Lambeth sites. They will also be on Chelsham, Hayworth and Greenvale units and will contain essential resources for you to care for a deceased person and guidance through the policy. There is one centralised death certificate book. This is at the Bethlem site and you should contact the DSN office to access this. Staff support via critical incident staff support is available at sis@slam.nhs.uk. Chaplaincy are available for client, carer and also staff support. They can be emailed at chaplaincy@slam.nhs.uk or via telephone at 82815.